Okay, we're going to begin our press briefing for today. Today's May 13. I'm Peter Zanoni, Corpus Christi City Manager. This is our joint Nueces County, City of Corpus Christi press briefing dealing with COVID-19. It's to help keep the community educated. Over time, we've provided information to the community on orders that the governor has issued, or the judge, or the mayor. And we share statistical information with the community so you can be up to speed with number of cases in our community and the health of those that have COVID-19 and how they're recovering. A lot of what I talk about in the beginning of these press briefings is on our joint city-county web page that was created for COVID-19. There's a nice dashboard that's on there, and it's been formatted for cell phone use as well. So if you ever want to revert or reference those tools on our webpage, you can find them on the city's website or the county's website. There's a link to our webpage. So we appreciate the community watching. We know a lot of folks watch on YouTube or Facebook or through some of the channels that are here covering, and we appreciate them covering the channels, Chris 6 and KIII. They've covered some of these events live for the duration of them, so we appreciate that. We know the information is important to the community, so those that are watching, use it for yourself, your family, share it with your friends, neighbors, and folks you interact with in the week. So today, what we're going to do is probably a little bit of a shorter briefing from yesterday. I'll provide the statistics on our COVID-19 situation since yesterday, the past 24 hours. And with me today, as I mentioned yesterday, is a guest speaker of sorts, Tom Schmidt from the Texas State Aquarium. We asked Tom to come forward because he plans, with his board's approval, to reopen in a modified manner on Monday. And I've worked with Tom now for about a year, but he has a great reopening plan that, one, keeps his employees safe, but two, keeps the customer safe. And so I thought it'd be good for him to explain to the community, in case any of our residents are planning on going to the aquarium, what they can expect, but they can also see what an institution like the aquarium's doing to change business practices for the foreseeable future, and how they're changing to make sure, one, they keep employees safe, but two, they keep the customer safe. In fact, Tom's plan that he shared with me a couple weeks ago, we actually used here in the city as an example for our directors of our 32 operating departments as they develop plans to bring some of our staff members back that had been on alternative work schedules because of COVID-19. So following Tom, we'll have Annette Rodriguez. She's going to talk to us about some of the ongoing COVID-19 testing and the monitoring as well. So that'll be today's lineup. Mayor Joe McComb is here with us in the back. Just want to point that out. He came today to listen, and joining us now also is County Judge Barbara Canales, and she will be speaking. Judge, you'll be speaking, right? Yep. So Judge Canales will speak after Tom Schmidt. She's going to give us an update on the STX Beef testing and tracing process that's been underway. And if I can just add, I didn't mention it yesterday, and I know the judge did, but on the on-front here, we want to thank STX Beef. They've been a great corporate partner in our community for some time, and especially with the COVID-19. Both Nueces County Judge Barbara Canales and Mayor Joe McComb have had great access to their company owner and the CEO over the past several weeks, working with them to help them with this COVID-19 situation. They've been, as I mentioned, an open partner, open community business leader. And they, even before we started making phone calls, made improvements to their processing plant line, making sure the employees were protected, putting PPE gear, so to speak, on their assembly line. They made substantial modifications to their break rooms, their cafeteria, to keep people social distance and to have some type of barricade, as an example, plexiglass, so persons' breath and stuff is not transmitting to the next, to their colleagues who are taking a break in the cafeteria and such. So we do owe a lot of thanks and gratitude for STX. It's great to have them here in our city as an employer and as a major producer of beef for Texas. And we're especially thankful that they're a great corporate partner working with us and allowing us to help them, help not only their employees, but help the community as well. Okay, so with that, let me talk to us about the statistics for today. And so every day at 4 o'clock, we look back at the past 24 hours to see how many new cases we may have picked up here in Nueces County, as well as we look at the recovery rate and other information that's been important to the community. And so since yesterday at 4 o'clock, for the past 24 hours, we're picking up 12 additional new COVID-19 cases. You can see it on the graph today. We've changed the color format a little bit to make it a little bit easier to see, but we had 15 on the 11th, 27 yesterday. We're glad to see it's dropped back down to 12 today, which is a good sign. We know that the 15 and the 27 were two isolated cases that we've talked to you about, the STX place, as well as the transitional housing facility that's in the near downtown area. So the 12 is some good news for us, and we expect over the next couple of days for that number to continue to decline. So with the 12 new cases, we've had now a total of 186 cases since we've been counting, but we have a recovery rate. So today there are 103 that still have the virus. Okay, so 186 in total from day one, but 103 are still with the virus, or still sick. The others have recovered. We have had 3 deaths so far in the county, and it's been a while since we've reported any new deaths, which is good. Those 3 include 2 Corpus Christi residents and then 1 Robstown resident. Our male-female distribution continues to go more heavily a little bit towards the male. 108 cases have been males and 78 females. Of the 12 new cases, they're in just about every age bracket from 0 to the 60 to 69 age bracket. So we picked up another one in the 0 to 19, and 3 in the age brackets of 20, 30, and 40, 3 each in those, and then 1 in the 50 age bracket and 1 in the 60 age bracket. And then number of tests, that's an important thing in our community, and we had between the city, the Texas National Guard, and then the hospitals and clinics, we've submitted or processed 422 tests today, and so that brings our total tests to date of now well over 5,000, so it's 5,356 tests performed in our community. And I'll show you some additional graphs in that in a moment. Okay, so on our recovery rate, this is our donut that we've been using. It shows the total number of cases. So of the 186, we have 103 that are confirmed and active still, and then 80 persons, though, have recovered. So as we get more positives and new cases, it brings down that recovery rate. It's 44% now of the total. It was well above, I think it was close to 60 a couple of days ago, but we'll get back there at some point. But 44% then have recovered, and we still have the 3 deaths. So some good news about the hospitalized folks. 1 person was released. It was 8 in the hospital yesterday. It's down to 7 today. And especially in the ICU, we had 4 in intensive care yesterday. Today, it's down to 2. So 2 persons have been released out of ICU and put into regular hospitalization. Okay, and then let's just talk about, before I show the 2 graphs, the location. So the 12 new cases that we're reporting today, 9 are from the city of Corpus Christi, and then 3 are from rural Nueces County. So that gives us a total of 165 in the city of Corpus Christi. We have 2 in Robstown, 7 in Port Aransas, 10 in rural Nueces County, 1 in Agua Dulce, and then 1 in Bishop. That's a total of 186. So let's look at these 2 graphs also that just show you some trending data. We've changed the backgrounds on these as well so you can see them a little better. This shows the daily testing. So on average, what this red line shows us is a 7-day averaging number. We are averaging today, and actually almost yesterday as well, about 200 cases per day, or 200 tests, I should say, per day, which is good. When you look back over here, we weren't at that number, right? It was much less than that. So on average, if you look back the past 7 days, we're averaging 200 tests performed every day in the county. That includes the city, our partnership with SPAWN, the private providers, and the state National Guard that are here. So you can see that the blue bars show the daily number of tests, but that red line is a 7-day average. So that's a good thing, that keeps going up. And then the next chart will show you our positive cases per day. And this one, obviously, we're a little worried about, but we know the line's going up because of those 2 isolated locations or facilities. Our average day, our 7-day average case is about 8.5, so about 8 cases on average. You can see the case numbers over here. That's the 8 that we're at now over here. So that's a 7-day average as well. It's not the day's number, but it's a 7-day rolling average into one day. You can see we were doing pretty good. We dropped down here to, I think it was about a 0.5. That's when we were enjoying some of the reporting. Down here we were at 0.5, but with these recent bigger numbers that we saw in that beginning graph, our 7-day average has gone back up, or gone up to the high that it's ever been, actually, of a little over 8 cases per day. So we'll continue to monitor this and continue to track it out over that average 7-day period. And if these 2 locations with the isolated cases remain just only those 2, that number should begin to come down. Okay, so that concludes the summary for the community on the statistics. And what we'll do at this point is have Gabby translate some of that into Spanish, and then Tom Schmidt from the Texas State Aquarium will talk to the community.
En resumen, con nosotros se encuentra el director ejecutivo del Acuario Estatal, Tom Schmidt, quien planea reabrir el acuario el próximo día lunes y hoy nos va a dar información sobre sus planes para la reapertura. Posterior a su presentación va a darnos más informes la directora del Distrito de Salud y la juez Bárbara Canales, también tendrá un breve. Quiero agradecer a la compañía South Texas por su cooperación con la ciudad y sus mejoras en la planta procesadora de carne para prevenir un mayor brote del virus en el lugar. En cuanto a las cifras, los números más recientes en las últimas 24 horas han reportado 12 casos nuevos confirmados por el coronavirus, haciendo un total de 186 casos. 108 son hombres y 78 son mujeres. La mayoría se encuentran en el rango de edades entre 40 y 49 años. A la fecha se han llevado a cabo 5,356 pruebas por el virus entre el Distrito de Salud Pública, laboratorios privados, así como la Guardia Nacional. De los 186 casos, 165 son residentes de la ciudad de Corpus Christi, 2 de Robestown, 7 de Port Aransas, 10 son residentes de áreas rurales. 80 de los 186 casos se han recuperado por completo. 7 personas continúan en el hospital, 2 en condición crítica en la unidad de cuidados intensivos y 103 casos continúan aún activos. A la fecha se reportan 3 fallecimientos.
Well, thank you, Peter and Mayor Joe, for the invitation today. I wanted to give a quick update on the Texas State Aquarium and our operations as we prepare to reopen. We actually never closed. We've had essential teams working at the aquarium, caring for our animals, managing our life support systems, engaging with the public through our social media channels, and also our wildlife rescue centers continued operating. So we did separate into 2 different teams, non-overlapping teams. We have good technology now to do thermal screening when staff come to the aquarium, so everyone's become accustomed to that now. We're certainly practicing all the CDC guidelines and other guidelines that we've received from the city, county, and state. And so I think for our essential teams, it's becoming a new normal at the aquarium, and we're understanding how that operates. As Peter mentioned, our plan is to open next week. We've been working closely with the governor's strike force to make sure that we meet all the guidelines. The aquarium is a little bit different operation than a lot of other entities, and so there's some specialized things that we needed to do to make sure that we could keep our guests safe, our staff safe, and our animals safe. So I want to let you know that when you do come back to visit the aquarium, it will be a different experience. One of the things that we've tried to do essentially is come up with a touchless experience at the aquarium, and that does run counter to our mission in some respects because we really like to engage our guests with our animals, but because of the crisis, we feel that this is important. Now, I think folks will be able to come to the aquarium, they'll be able to see all the animals, but it'll be at a little bit of a distance. One of the things that became a concern was a lot of the acrylic windows that we have. We know kids like to touch those, parents sometimes touch, and that's an opportunity for disease transmission. So we now have barriers in front of all of our major acrylic windows, allowing folks to still see all the animals, but maintain a safe distance. This is an example of some of the signage that we'll have at the front of the aquarium. So when we initially open, the only way to be able to get a ticket to the aquarium is you'll have to purchase it online. And that does two things for us. One, it allows us to manage capacity, and we have a good understanding and knowledge about how many people will be visiting over the next few days. It also prevents us from having to handle cash and our tellers from having to work directly with the public. So you'll come into the aquarium, the doors will be open, you'll scan your phone on a scanner, and then you'll be able to immediately walk through all the galleries. In every case where we have a door, that door will be open, all the exhibits will be open, but again, there'll be barriers that allow you to still see all the exhibits but stand slightly from the acrylic windows. We've also got a lot of floor decals. This is an example of one that you'll see all around the aquarium now. And again, encouraging people to practice social distancing. So we think this will also be an effective use and really encouraging folks to enjoy the experience, but again, maintain that important distancing. So we've taken this very seriously. I think we've got some great procedures in place. We won't be having dolphin shows initially. We won't be having the 4D theater initially. I think as the situation hopefully improves over the summer, we'll be able to bring some of that programming back. But for now, we really want to err on the side of caution and keep the experience down to individuals walking and families walking through the aquarium. I will share one final story. As I mentioned, our Wildlife Rescue Center continues to be active. We get patients every week, birds, mammals, and a couple of weeks ago, we got a call from a veterinarian in Austin that they'd found a baby river otter. It was about 4 or 5 weeks old, and it was on the side of the road. At first, they thought it was dead. And so they called us. We sent a team up there. We brought the animal back down. It hadn't weaned yet, so our staff was working 24 hours a day to nurse this animal back to health. We had a feeding tube in the nose. That was a challenge, I assure you, getting a feeding tube in a baby otter's nose. But the good news is it's been 2 weeks now. The animal's eating on its own. It's a wonderful, probably be a new addition to our family. And I actually think we have some information we'll be sharing with the press later. So our wildlife care and rescue work continues, and we're anxious for the community to come out and see all the animals, including our new baby otter. That's all I have. Thank you.
En resumen, en cuanto a las operaciones en el acuario estatal, aunque el acuario no ha estado completamente cerrado ya que se ha continuado el mantenimiento con los animales, nuestro plan es reabrir el próximo día lunes siguiendo todas las pautas del gobierno. Pero van a haber cambios, aunque queremos que los visitantes estén cerca de nuestros animales, ya no habrán áreas para tocar a los animales y van a haber separaciones plásticas para asegurar que las personas estén seguras. Habrán más señalamientos como el que se encuentra enfrente en el área, pero también habrán barreras plásticas. También tendremos calcomanías en el piso para establecer el distanciamiento social. El programa con los delfines va a estar suspendido hasta próximo aviso. Continuamos recibiendo animales lastimados. Hace unos días recibimos una marmota lastimada, así que tenemos una nueva adición a nuestro acuario.
Thank you. Barbara Canales, Nueces County Judge. First and foremost, let me report that all the testing of STX Beef is now complete with the Texas Guard. And so we are very, very grateful to the state of Texas, to TETM, to all those involved, especially those employees and STX management who made that possible. We realize that this is a cooperative effort, and it is for the sake of public health and for those workers and their families. So now that they've been completed, we can now report some data to you, and you will hear that data shortly from Annette Rodriguez, who is our health director. Let me pivot to talk about the families. I think that's one of the things I really want to stress is how important it is that we have an opportunity to have a system that is so safe, so easy, and so efficient in reporting results through our city-county health department. We've been running these drive-through tests now for over a month, and we've done so with great success. When you test in the morning, by late that afternoon, you have results. If we tend to have 100 people or more tests, sometimes it does take till the next morning or late that evening, because as you recall, we test 21 at a time. However, we also have the additional testing capability that Krista Spahn's Gen X Infinity that diagnostic laboratory device gives to us. So my message today is very simple. To families of STX Beef employees, I want you to know that this city-county health department will dedicate all its resources to making sure that you have available, free, and easy testing this week, and beyond that, if necessary. Now, we have been manning a hotline at the county all morning long. I will say that the phones have been ringing off the wall. We brought in extra people to help answer the phones. We have the ability to answer in English and in Spanish. We calmly give directions and an understanding of the process, and we want to provide this number to you again. The testing is going to take place tomorrow, Thursday, at 8 a.m. And by the time you are watching this press briefing, our cutoff time for tomorrow's testing has already passed. But I do not want you to worry, because if needed, we will make sure there's additional days for you to test. So we're going to test tomorrow for all those people that have family members or people living in a household unit that had someone working at STX Beef. But we will have additional days as well. So let me repeat the number. It's 361-414-6700. Once again, it's 414-6700. Y si hablamos español. You can get the information in English and in Spanish. What I want to convey to you is that I know there are many of you that are listening that are concerned. I know that you might be anxious or worried. And what I want to tell you is that I know that the process we have is a good process. You will be able to get your appointment easily. You will be able to go through our drive-through testing, and very quickly you will get the results, and we will give you further instructions on what to do. So, most likely, if, as I said, by the time you hear me, the cutoff for tomorrow morning is over. But we will extend it, so call the number. Leave a message. We will get back to you as soon as possible. You'll recall yesterday that I talked about how important testing is and how important that second part of that Texas two-step is in contact tracing. We continue to work with our state partners. We've submitted the STAR request asking for our Texas tracing team. But in the meantime, we've already received wonderful opportunities to share with Annette that the Nueces County Medical Society has offered their ability to send physicians who can they can offer their services of contact tracing. And I'll be visiting with Annette about that. She's hearing that for the first time, by the way. That's how you know you're getting this news in real time, because I'm telling her in real time as well. The bottom line is this: we're going to do whatever it takes. Do you remember what I said yesterday about all hands on deck? Well, it's real. And we're going to use all hands on deck. So I want to say thank you to the Nueces County Medical Society, Dr. McCutcheon, and all your volunteers. Just your willingness to reach out, connect with me, and say, we'll serve. We're part of those hands. And if we can use you, we're going to put you to good use. And again, as we wait for our Texas tracing team, we'll make that transition. In case any of you are interested, I think it's fascinating that every county in Texas has an extension agent. Every one. I think actually there's one that out of the 254 that does not. I think that because it's all rural, but everybody has an extension agent. And so the state of Texas wisely has sought out a mechanism to use the extension agents as tools and resources for counties. And we have a great extension agent here, and we have already reached out to him, and he will be working with our county to make certain that this Texas tracing team helps Director Rodriguez make sure that as she reports positives today, and the ones that we reported yesterday, that we have all the necessary folks to do the contact tracing. So, I want to reiterate to you today how good a feeling it is to know that we accomplished testing in a time frame that encompassed less than 5 days to do almost 750 employees. This is a tremendous feat, and it doesn't happen by accident. And so I want to thank everybody again involved and let you know that we are always ready to rise to whatever challenge presents us. And I also want to take this opportunity as your county judge to again remind everybody that we all have a responsibility with regards to how we take care of ourselves and how we take care of each other. And as we see our numbers go up, it's more important than ever that we do our part to flatten that increase. And I think that every weekend it becomes more and more difficult as we feel the need to make certain that we get out and enjoy the things that are important to us as we reopen Texas, as we participate with our businesses and getting our economy revived once more. As long as we do it safely, then all of us are part of the solution. And so wear your masks. They are highly recommended in public spaces in particular, specifically when you cannot social distance. And I don't know, here's Tom. I just want to say, I, for one, will be at the aquarium this weekend. I look forward to seeing not only that beautiful new baby otter, but being a part of not just reopening Texas, but getting back to that coastal bend economy thriving again. So we can all enjoy the things that we love if we do them safely. So I thank you, and I will be here to answer questions with regards to the testing and regards to the opportunity that we are giving to all family members. And let me just say, as closing, you do not have to have any symptoms. The only requirement is that you live with somebody who is an employee of STX Beef, or you are directly related to them and have had some sort of a person-to-person contact, some direct contact. So you do not have to have a symptom, and I would appreciate if in the media, if you all would please flash that number up of 414-6700. If you do not receive a call back instantaneously, again, it's after hours, but we're monitoring every single email that we get, and it sends us a direct message. So I don't want you to worry if nobody answers the phone after 5. We're still going to get your message. If we attack this situation with calm and with decisive action, we will make certain that we have a strong outcome. Again, thank you, and I will answer the questions after Director Rodriguez has had a chance to visit with you.
En resumen, ya hemos terminado con las pruebas realizadas en la planta procesadora de carne South Texas. Ahora tenemos datos para ustedes que los dará la directora del Distrito de Salud. Ya llevamos más de un mes realizando las pruebas móviles y normalmente tenemos los resultados en unas horas. Ahora contamos con la adición por parte del Hospital Spawn. El mensaje para las familias de empleados de la planta procesadora es que se tendrá la prueba gratuita. La línea de información está disponible en inglés y en español. Mañana se va a llevar a cabo otra prueba para quienes ya se han registrado y tendremos pruebas adicionales. Solo tiene que llamar al número 361-414-6700. Si usted llama, se le llevará a cabo una prueba y se le dará toda la información necesaria, especialmente si resulta positivo. Vamos a hacer todo lo que esté en nuestro poder para llevar a cabo este esfuerzo y le agradezco a la comunidad médica todo su apoyo. También esperamos contar con más personas para llevar a cabo los rastreos por contacto, gracias al apoyo de los agentes de la extensión por parte del Estado. Mientras vemos que las cifras aumentan, es muy importante continuar haciendo lo posible por aminorar los casos. Use un cubrebocas, especialmente cuando no se puede llevar a cabo el distanciamiento social. Así podremos disfrutar de lo que queremos de manera segura. Recuerde llamar al número para registrarse al 361-414-6700.
Thank you. Annette Rodriguez, Health Director. As Judge Canales mentioned, the Health District's next drive-through is tomorrow at 8 a.m. at the Old Memorial Hospital. After yesterday's governor's orders, the Health District will be working with all nursing home and the state surveyors to get them tested within the next 14 days. We have already started organizing sample collection with Krista's Spawn staff as well as the fire department, and we will continue to communicate with these critical infrastructures so that we can ensure that all are tested. Here are the results from the meat processing plant. The total numbers of persons tested were 747. That includes individuals, not only employees, but also contract workers and even vendors were tested. The total number of positives are 63. So there have been a lot of questions about the meat and the foods, the packaging, et cetera, et cetera. So currently, I just want everybody to know, there is no evidence of food or food packaging being associated with transmission of COVID-19. The FDA advises we will adopt everyday safe food handling and hygiene practices to avoid foodborne illnesses. Safe food handling techniques are to wash your hands and surfaces often, again, like we've been talking about. Separate the raw meats from the other foods, cook to the right temperatures, and refrigerate your foods promptly. Due to the governor's orders in ensuring all senior centers are fully tested, our next drive-through setup for the health department will be either the last week in May or the first week in June. We will continue contact tracing for all positive cases, and we will work with our current cases. You can still call the COVID-19 phone bank if you have questions at the 361-826-7200. And testing is also still available throughout our community. The military testing team, some people call it the National Guard, is around, is local, so you can call 512-883-2400. Also, the Coastal Bend Wellness Foundation at 361-356-9572. Stay well and stay informed. I'll be available for questions after. Thank you.
En resumen, la próxima toma de especímenes del Distrito de Salud es mañana a las 8 de la mañana en el Hospital Memorial. Después de las órdenes del gobernador, el Distrito de Salud trabajará con todos los centros de atención para personas mayores para que se realicen las pruebas en los próximos 14 días. Ya hemos comenzado a organizar la recolección de muestras y continuaremos comunicándonos con estas instalaciones para que todas estén incluidas. Las cifras más recientes que tenemos en cuanto a la planta procesadora de carne, se llevaron a cabo un total de 747 tomas de especímenes para la prueba. 63 casos resultaron positivos. Actualmente no hay evidencia de que los alimentos o los envases de alimentos estén asociados con la transmisión del virus. La Administración de Alimentos y Medicamentos, o FDA, informa que se han tomado prácticas de higiene y manejo de alimentos para evitar enfermedades transmitidas por los alimentos. Las técnicas seguras de manejo de alimentos son: lávese las manos y las superficies con frecuencia, separe las carnes crudas de otros alimentos, cocine a la temperatura correcta y refrigere los alimentos rápidamente. Debido a las órdenes del gobernador de garantizar que todos los centros para las personas de la tercera edad se les lleve a cabo una prueba, nuestra próxima toma de especímenes del Departamento de Salud será la última semana de mayo o la primera de junio. Continuaremos el contacto para rastrear todos los casos positivos y trabajaremos con nuestros casos actuales. Todavía se puede llamar al banco de teléfonos del virus si tiene una pregunta. El número es el 826-7200. También puede realizar una cita llamando al 512-883-2400 o a la Fundación Coastal Bend Wellness al 356-9572.
Hi, and I just wanted to follow up with a little bit more information about the aquarium. As I shared, and as Peter shared, and as the judge shared, our intention, we are preparing to open the week of the 18th, which will be when the Phase 2 facilities that are within the strike force are designated to open. We continue to work closely with the strike force to make sure that we're meeting all their guidelines, and I'm hopeful that we'll get final word from them toward the end of this week. But yes, our intention is to open sometime the week of the 18th. It could be as early as Monday, it could be as late as Friday, but next week we have targeted for us to reopen the aquarium. A couple of other things I wanted to share with you. All of our staff will be wearing masks. We're going to encourage our guests to wear masks. We'll have additional masks available if guests need them. So again, we're going to really encourage that when folks are coming into the aquarium. Also, all of our major restrooms are all touchless, and so someone can go in there, they can use the restroom, the lavatory, they don't have to touch anything. All of our sinks are hands-free, and so we're going to encourage everyone when they come in to wash their hands and continue to wash their hands throughout the experience. Even though they're really not going to be touching much, we want to encourage that as much as possible. So just some additional safety measures that we plan on putting in place to make sure our guests are safe, our staff are safe, and our animals are safe. Thank you.
Información adicional. Planeamos reabrir la semana del 18, asegurándonos que tenemos todo preparado para esta reapertura. Le queremos informar que todo nuestro personal va a contar con cubrebocas, las mismas que estarán disponibles para los visitantes. Asimismo, los baños también serán automáticos y así no tendrá que tocar nada adentro de los baños.
Okay, great. Some of the questions we've had on Facebook were to clarify what our health director mentioned in terms of the test performed at STX. So let me try to do it here, and Annette, if I'm not capturing it, come on up. But so all the tests that were performed for employees, vendors, or contract employees at STX, remember you take the swab from the nasal passage, all those tests have been analyzed, and that number that Annette gave us of 63, that's the number from all the analyzed process tests. There's no other tests that have been taken in the past couple of days that need to be analyzed, right? So the 63 number includes the results of testing all those employees, the close to 800 employees at STX, vendors, and contract employees. If they were tested Sunday, Monday, Tuesday, all of their tests have been analyzed, and all of the results are in, and the results are 63. Now, there could be additional tests that are performed, the swab analysis. There could be an employee that goes to the doctor today. They could go to a drive-through testing site tomorrow. And so there could be additional cases in the future if somebody goes and gets an additional test. And remember, that's one of the issues with COVID-19 is you could feel fine today and be a carrier and you don't know, but if you get tested tomorrow and you have it, then you're positive. So. But I wanted to clarify that for our viewing public. All the tests that were performed at the STX plant, whether you're an employee, a contract employee, or a vendor, they have been analyzed, and we're reporting the number today, which is at 63. Okay, great. So that concludes our presenters. We want to thank Tom Schmidt. We know he, even though he doesn't have customers or patrons, he's still busy keeping all those animals alive and running, which is a little mini city over there. And so he's been busy. We appreciate him coming out to talk to the community. It's just, we thought it'd be good for the community to listen to one example of how a big institution, a big attraction for the region, the state even, is dealing with COVID-19 and how they are going to open back up in a smart way, but one that protects the employee and also protects the public and their animals, we should add as well. And so we thank you, Tom, for being here today. We hope that the community got a little bit of a benefit from that and can help pass those words along. Today is Wednesday, so tomorrow we will have, as we usually do on Tuesdays, Thursdays, we'll have back Nueces County Judge Barbara Canales and Mayor Joe McComb, who is with us today. Won't be speaking today, but he'll be here tomorrow as well to give some updates on some of the things he's working on with other big mayors across the state. Annette and I will be here as well. And then on Friday, we'll have back our team from Texas A&M University. They're continuing to develop another presentation for this Friday. They've been analyzing our numbers in relationship to other Texas cities, and there's going to be some new charts that'll reflective of some of our numbers we've had in the last couple of days. That puts us in line with some of the other Texas cities. For a while, we've been out of the shadows of them, but we'll see their charts and graphs on Friday. They're continuing to work pretty much the 40-hour week with their colleagues at the university and others across the country. They're updating their models based on the worldwide models being updated, and they're updating them with statistics from our region and from the city. So tune into them. It's a good way to get some real good information from Texas A&M Corpus Christi, specifically with COVID in our area. So they'll be here Friday. Okay, so at this point, we're going to turn it over to the media if they have any questions for either myself, Tom Schmidt, the judge, Annette, or even the mayor. Did you want to say something? Okay, we're going to add one thing real quick from the judge.
I just want to add that I just got a note from my office, and just to show you how important these briefings are and how thankful we are to the media for getting our message out. We have over 160 people signed up for tomorrow's testing. And so, again, you know, this is part of our not only responsibility, but being able to offer this service is really a testament to working together. And 160 family members will have ease and peace of mind by hopefully, that's quite a few, so it may be tomorrow and the next day that we get those results. Because, as I said, we're going to run them 21 at a time. But it is a really good result from that hotline. And I just also want to say, whatever questions you have throughout this COVID response, these hotlines are not going to go away until our disaster goes away. So remember, there's another hotline, and it's the Nueces County hotline for just general questions, 414-6000. And of course, the health department is always a resource to you at 826-7200.
I just wanted to see if there was an update on nursing home testing, and now I guess the governor has ordered that the National Guard disinfects all nursing homes.
Yeah, do you want to? I have talked to Chief Rocha today. You have as well?
Do you have the numbers of how many?
You know what I do, but I don't have it
do
here
too on
with
my
me.
phone.
Yeah, the numbers of facilities.
Let me get that for
Yeah.
you, Peter. while you-
Okay, while the judge is getting that, so Chief Rocha has been engaged by the chief emergency person from the state, Nim Kidd, and Chief Rocha and a team of firefighters are being asked to go into the three different types of care facilities for seniors, nursing homes, there's assisted living facilities, and then another grouping. But those three groups of about 30, I believe, but the judge will get the numbers. They're going to go in and help perform assessments of the sites. And so that it will be in coordination with the state, using our resources here, kind of similar to what the National Guard's doing now. So our fire department will do that here locally with some of these senior care facilities. And Judge Arnett have the numbers. Okay, Annette has it, okay.
We have 16 nursing facilities. We have 12 assisted living facilities. We have 15 long-term living facilities. And we are working to get the number of residents in each of those. But I will tell you that the most important thing that we did today as a city EOC and as a county EOC is start getting those STAR requests in, because we're going to need thousands of swabs. We're going to need a tremendous amount of VTM, that viral transfer media. I know that we put in a huge request, through our office, 1,000 individual tests on the Cepheid machine. That's that Christus-Spawn fantastic molecular diagnostic machine we talked about earlier. So when we're talking about testing thousands of people in a 2-week time frame, that's what the governor has asked us to do, 14 days. We've got to have the resources. So if you see us kind of juggling, it's because we have been truly moving fast today. But we hum in the way that you would want a well-oiled machine to do so. We are going to have our 100th day pretty soon of the EOC being up and running at the county. And that is an incredible testament when you really believe, when you think about the way disasters normally occur in a hurricane. Typically, you never get to your 100th day in active mode, ever. You might be 2 weeks in active mode, maybe, and then you move immediately to recovery. We're doing everything at once. So I just want to say that I have a tremendous amount of confidence in Chief Rocha, in Billy Delgado, in Chief Richie Quintero, and the whole EOC staff, but particularly in the fire department. And I know that they have been working logistics, and we're going to get resources, and we're going to use every method available in order to tackle this important issue. And I'll tell you, I don't think we should stop there. When we finish nursing homes, we need to look at other vulnerable populations. There's colonias, there's homeless shelters, there's a variety of opportunities to continue the quest to test.
Just a follow-up.
Yes, sir.
The disinfection team, do you know anything about it? Or
To be honest with you, I'm going to yield to Peter on the disinfection team. I really don't know much about that. I can tell you that that doesn't surprise me. At the county, anytime we're asked to go into a facility that has had what we believe is a positive case or multiple positive cases, particularly in first responders, we have a company that we utilize that disinfects and uses UV light as well to kill the virus. So it doesn't surprise me. I just need to get more information back to you. I can tell you that jails also have been targeted by the governor, so don't be surprised if we announce quickly that we're going to have plans to test our detention facilities. There's more than one detention facility in Nueces County. That also is a directive. So we will tackle these challenges with logistics, with resources, and with the same type of preparedness that you've seen as we tackled STX Beef.
One more question, Judge. Were all the tests from the STX Beef done at the new machine that was brought last week?
I'm going to yield to Annette. The question is whether or not the family's testing a memorial. Will we run those through our lab or through Spawn? Okay, so I'm going to correct myself. We'll be able to get all those results back tomorrow because Spawn's machine is so fast. Every 45 minutes, 26 tests. So do the math, 160 tests, we'll be having those answers to those families very quickly. And again, why is this so critical to be quick? Because the quicker you know that you're a positive, you can isolate, you can take care of your family by making sure that spread of the virus is contained. It's absolutely critical. Time cannot be our enemy as well. And so with Spawn's rapid tester and with our incredible testing capability, we can do 1 a minute. We can test 1 a minute at Memorial, and we can be 26 quick and 45 minutes through Spawn. I have to be honest with you, I don't know anybody that does it better or faster than Nueces County.
Just on that clean team question too, we just spoke with the fire chief, so he's unaware of any cleaning responsibility that the state's asking us to do. What's that?
The National Guard, I believe.
The National Guard, the same, okay, he's unaware, so if we learn something between today and tomorrow on the clean team from the National Guard, we'll let the media know.
The 12 that came back positive today, were those from STX or were those from?
I think 6 were from STX, and then the other 6 were non-STX employees.
And I just want to make this clarification. As we get numbers, I know it gets tricky, but we tackled STX 3 different ways on testing. And this is important to know. The bulk of them, the 700 plus that Annette referenced, came through the services of the Texas Guard, okay? With 2 different labs, Spawn and wherever the Guard sends their laboratory to in the state of Texas, okay? However, there were folks that were tested prior to that 700 being tested, and they used the City County Health Department. In addition, there were another group of tests that were done by the Coast Bend Wellness Foundation. When you add all of them together, you get the numbers that Annette Rodriguez shared with you earlier. But the overwhelming majority the Guard did was the tremendous feat. The others were done at different times and intervals. So the 6 that you know of today came through Memorial, drive-through testing, City County Health. That's why they're not a part of the testing. And just so you know, we received that information just moments ago. Well, at least I did.
You good, Courtney? Any more questions? Okay, Chris 6, any other questions? Okay, great. That concludes our questions. We appreciate the media asking those questions. We're here to get information out to the community, obviously, so that's part of why we're here. So that concludes our presentation today. We'll be back tomorrow at 5 o'clock, myself, Annette, County Judge Barbara Canales, and Mayor Joe McComb. We'll see you then. In the meantime, stay safe and remember to practice some of those safe tips that Annette continues to talk to us about, which includes social distancing, washing our hands, keeping dirty hands off our face, and staying away from people as much as possible, right? Thank you. Good night.